Hello, my name's Jayself and I'm a paediatric eye surgeon, and I'm also an associate professor of genetics at the University of Southampton, so a funny mixed job. So I've been asked to answer lots of questions, so I'll start now. Well, I chose to be a doctor, I think, because at school I was very into sport and not really into doing much work. But I injured myself a lot, and through those injuries, I got an interest in the body. I always found science quite interesting, and it really sparked from there, I suppose. So once I became a doctor, I decided to do eyes because I was always interested in doing something paediatric. And I got the opportunity to do children's eyes. So that's why I did eye surgery, and I quite like the surgery. From the research side of things, I always like genetics as well, so that's why I've got a funny sort of combined job, I suppose. Well, I don't really have an average day, which is why I like my job. So half of the week I spend seeing patients in clinic, seeing babies with genetic eye diseases and doing surgeries. And the other half of the week I spend doing research into those sorts of things. So lots of genetic work, lab work, cells, all that kind of stuff. So there isn't really an average day. I do a lot of talking, a lot of speaking at conferences. I write books, I write papers. I supervise PhD students, we teach medical students, and then there's all the normal doctory stuff of doing surgeries, seeing people in clinic, looking after people in front of you, and some of those that can't come into clinic, etc. Well, from the doctor point of view, actually, ophthalmology is quite a good option if you don't like working in the middle of the night, because we don't do a huge amount of night work. And someone once wisely told me that people only realise they've gone blind when they wake up in the morning and open their eyes. So ophthalmology, in terms of doctoring, is quite a good option. We do work hard. We work very hard when we're in. And from the research side, it's much less prescriptive. So generally, people don't really care what you're doing at any one moment. It's about getting things done within a certain time frame. It's great for working with other people. If you like working with people of all different backgrounds, then to be honest, both the medical side and the research side are fab. I enjoy both of them. Well, I got in through going to med school primarily, and then through med school, I then made my choices. But to get into medical school, I did a few things at the end of my school training, really to help with CVs and also to really get some experience and see what it would be like. So I did some work at a friend whose dad was a GP, so I did some work at a GP practice. I also did quite a lot of work in a number of other sort of places where you can help people. So I did helped with riding for the disabled. I helped children with swimming lessons, that sort of thing. And I also did some other bits and bobs really to get some exposure to what I thought being a doctor was going to be like. So next question is, what skills do you need for your job? Well, I think the most important skill I have is being able to encourage people to help me do things, because every little bit of what I do, there are lots of people who are fabulous at doing that, and they do that all the time. So as I have such a varied job, what I do is spend quite a lot of time getting the right people to do the right things. From the surgery point of view, what you need to be able to do is focus. It's very much like sport in some ways. If you can focus and really concentrate in the moment, that's what surgery tends to be about. And from the medicine point of view, it's about having compassion, really caring about people and thinking about how you can help them in whatever way that would be. And from the research point of view, it's really much more about being very interested. So it's also important to have compassion and make sure you're researching the right things, but you've got to really have a quizzical mind for research. For me, it's seeing patients, playing with kids for a job. What can be wrong with that? So I play with babies most of the time in my job, and I liaise with loads of different people of different ages, different backgrounds, all sorts of stuff like that. So those are the things I really enjoy, but I also really enjoy doing surgery as well, because it's extremely satisfying. And you know it's important, you don't want to get it wrong, but ultimately what we're doing is something which is going to help somebody, and it's really satisfying to see that through. Are there parts of your job which you don't enjoy? Yes, I think most jobs for me have a reasonable percentage of parts which are a bit boring. but it's about minimizing that, choosing things where you can make that as small a part of your job as possible, and also where you can get some enjoyment from those things. So for me, that might be writing letters, dictating, doing boring paperwork in the clinic. But actually, if we really think about it, all those things are doing real benefits for people. So you have to kind of change your mindset a bit about it. From the research point of view, some of the boring bits are applying for grants. So spending hours and hours and hours trying to get money from charities to pay for things. When they don't do it, you feel a bit like you've wasted a lot of your time. But actually, that's part of our job to do that. So there's not a huge number of things I don't enjoy, to be honest. I do love my job. Well, the main thing is to try and make meaningful improvements. So it'd be quite nice to retire and know that children are dealt with much better than they were before, that we've cured a few, hopefully cured a few diseases and made things a lot better for patients where we can't cure them, but we can support them better and manage them better. And a lot of what I do is trying to encourage other doctors to do similar things and learn from our experience as we learn from others' experience. So those are the things that I really want to come out of my job. I'd say go for it. Be passionate, be interested, throw your energy into it, and it's amazing what you can get out. I definitely believe, certainly from my experience, the more you put in to any job or career, the more you get out. But if you can start off from a position of really enjoying fundamentally the thing that you're doing, that's fabulous, and you're very lucky. So final question is there anything else you'd like to say about your job? So not really. We were asked to mention COVID. COVID obviously has had a huge impact on everything we do at the hospital and certainly in research. In research, the problem we have is that we have labs with lots of cells and people pipetting things and stuff. And we've had rooms where you can only have one person in them, whereas we used to have 20. So that's really impacted the research. But on the clinical side, it's even more obvious. The eye unit in Southampton, which is where I work, has a huge backlog of patients. So at certain times we've had 20, 30,000 patients for which we haven't got a planned appointment or surgery date. So it's about dealing with massive backlogs. So COVID has had a huge impact on what we do. There are a few good things that have come out of it. So everyone's learned how to use online systems a bit better. There's some things we're going to certainly start doing in clinic which seems to work quite well, or whether we thought they wouldn't. So some benefits have come out of it, but largely COVID has had a massive impact on both sides. So I think that's it for all my questions. I wish you all the best, and if anybody wants to consider anything in research, or particularly medical research or doctory type stuff, please do get hold of me. I'm happy to talk to anyone. Good luck, everyone.